So proton beam therapy is a newish technology, although it's been around for probably the last 10 years. It's been commercially available across the world for 5 to 6 years, mostly in the Northern Hemisphere at the moment, and mostly in Americas and a few schemes throughout Europe. Now the treatment itself is an incredibly clever technology, if you like, where there's a cyclotron used, similar to the synchrotron, as you may have heard of in CERN. And the cyclotron basically accelerates the protons faster than the speed of light. So the way that the PBT works is it can direct the beam and the proton beam directly onto the tumour, and it can effectively peak its energy load onto the tumour from a depth perception, if you like. The protons then effectively scan across the tumour, and the best way to describe it would be they suck out the positive charge from the tumour, and thus the tumour dies over the course of the next few months. Most cancers that are based around solid tumours, so that can be prostate cancers, brain tumours, some forms of breast cancer. And again, the technology is such that as it scans the tumour, that's where the benefit is. Whereas normal treatments, radiation treatments, they effectively go all the way through front and back of the tumour, all the way through the body. Now that obviously has a massive reduction in side effects, and taking prostate cancer as the example, there's almost no side effects, but the benefits, the success rate is about 99% compared to traditional treatments. So the real benefits of PBT are essentially lower side effects, lower number of treatments, lower ongoing treatments, lower recovery rates, or faster recovery rates, but also in the overall scheme of things, it's cheaper as well. So at the moment there's round about 12 facilities currently operational. There's another 3 or 4 in planning and in construction. They're available mostly in the States at the moment. And then we have Japan, the Czech Republic, we have Singapore, Korea. Yeah, the technology is, it's been around for 10 years or so, the actual technology. It's been commercially available within the healthcare practice for about 5 years. The reason why there's so few available, and none in the Southern Hemisphere at all, is the capital cost of constructing one. Typically, if you imagine a radiology department in a hospital might cost 30 to 40 million to construct. A proton beam therapy clinic is likely to cost you $200 to $300 million to construct. And that's the main reason that it's not available yet. The health system doesn't recognise it as a treatment, if you like. And without the federal government backing it, without the state governments backing it, and without all the health boards around about Australia backing it, it doesn't have the throughput that can make it financially viable. All of the facilities available elsewhere in the world are all private facilities. So if you imagine the facility in Czechoslovakia, it's a private facility which the local government and a lot of the European health providers will recommend their patients to. At the moment in Australia, that's not currently there. Now, there are 2 providers that we know at the moment that are really keen to come and fund the construction of a facility in Australia. There's actually one looking to build one in Brisbane. The problem they're having is getting support at federal level and state level, and again at Queensland Health level, if you like, to recognise it as a treatment. If we can get that happening, and that's one of the key things of our charity, if we can get that happening, then the whole thing will become commercially viable and we will have proton beam in Australia.